Hi everyone, I hope everyone's doing well. For today's video, I would like to explore some of the acupuncture points that corresponds to the facial lymph nodes and the lymph nodes of the neck. The first one I would like to talk about is the occipital lymph node. This one happens to correspond to acupuncture point GB20. GB20's function in acupuncture is it helps to dispel wind and clear heat and cold. So that means that it's good for things like allergies, common cold, and flu. It benefits the hearing and vision, clears the head and open the portals. So it helps to open the five senses. It relaxes the sinew. So as a lymph node, if you remember, it helps to drain from the occipital scalp area. So it makes sense that it helps to clear the head. I think as a lymph node, it helps to also open the five senses, working with other lymph nodes in the face and the neck. And as an acupuncture point, it makes sense that it dispels external pathogenic vector because it's located near the nape of the neck. So we in Chinese medicine consider that pathogens from the outside can enter the body through the nape of the neck, this area. Secondly, the mastoid muscle, the mastoid lymph node corresponds to acupuncture point GB12. And GB12's function is it helps to dissipate wind, both external and internal. So, external wind, like I talked to you about, is considered more external pathogenic factor that enters the body through the nape of the neck, so this area. And internal wind is considered things like tremor, dizziness, and loss of balance. Um, Also, interestingly, it helps to quiet the spirit. Its indications are headache, swelling of the cheek, auricular pain. If you remember, this lymph drains from the posterior neck, upper ear, and back of the ear canal. It makes sense that it helps with the swelling of the cheek and auricular pain. If you look at the function as a lymph node. Third is preauricular. Preauricular lymph node corresponds to acupuncture points GB2 and GB3. GB2 helps to clear the channel of the liver and the gallbladder, and it dispels wind and TMJ pain, jaw pain. GB3 is good for toothache, local pain. As I think, if you look at the lymph nodes function, its function is to drain from the facial, superficial facial, and the temporal region. I think as an acupuncture point, it really works more in the level of the muscles. So it's really good for things like jaw pain and toothache. Um, Fourth is the parotid, and that one corresponds to acupuncture point stomach 7. And stomach seven's function is it helps with the pain in the face, motor impairment of the jaw. Also, I think as a lymph node, it's going to be really good for sinus congestion, sinus infection, because it helps to drain from the nose, nasal cavity, ear canal, and lateral borders of the orbit. Fifth is the submental. And this one corresponds to acupuncture point REN 24. And this acupuncture point helps with facial puffiness, Bell's palsy. If you look at the name of REN 24, its English name is fluid container. So that indicates that it collects fluid from the face and it collects right there. So I think as an acupuncture point, it helps. That's how it helps with the facial puffiness and also Bell's palsy. In terms of lymph node, it's really drains more locally, the lower lip and the apex of the tongue. Um, Sixth one is the submandibular. Uh, it's right here under the chin, and this area there are no acupuncture points, but it's close to stomach 5 and 6, which is more on the supramandibular area. Um, Seventh, the facial lymph nodes. There are three. The first one is the infraorbital lymph node. This one corresponds to stomach 2, and stomach two's function is helps with facial paralysis, painful itching of the eye. Makes sense. It drains lymph from the eye area. Um, Next one is the buccal, and that one is it corresponds to stomach 3, and it's good for facial paralysis, twitching of the eyelids, swelling of the eyes and cheeks. So I think as a meridian, stomach starts right under the eye and it goes down. So it makes sense. It's good for benefiting the eye and the cheek area. Um, Next one is the supramandibular, and that one is over here, and it corresponds to stomach 5. And this one is also good for facial paralysis, swelling of the cheek, um, like stomach 2. I mean stomach 3. And then as continuation of the meridian, makes sense that it could be good for the face, local area where the stomach channel runs. The number 8, superficial cervical. That one is anterior to the SCM in the angle of the mandible, and that one corresponds to acupuncture point small intestine 17. And this point also is part of the windows of the sky points. I will also do a video on the windows of the sky points because they are very interesting points in acupuncture. Um, anyway, so this point is good for deafness, sore throat, swelling of the cheek, goiter. And as a lymph node, it collects lymph from the superficial surface of the neck. So it makes sense. It's good for sore throat. Also, it makes sense that it could be good for swelling of the cheek. I think as a lymph node, it works all together. So it could be good for that. Um, Also, because it's by the ear, it could be good for deafness. Lastly, the inferior deep cervical node. That is lateral to the SCM on the top of the clavicle. And this point is stomach 12. And its name in English is empty basin. That's very interesting to see the name because in terms of its function, lymph node function is to drain everything from the face and neck. Um, it's as an acupuncture point, good for cough, asthma, and sore throat. So it helps to drain everything from the neck. That's how it could be good for those things. Um, Overall, if I were to take a look at the different acupuncture points that correspond to the lymph nodes of the face and neck, you can see that there are many stomach points on the face. And in terms of Chinese medicine, stomach channel, stomach meridian, the stomach energetics, its function is to ripen and the rotten the food that we take in and the liquid that we take in, and then it extracts the nutrients from it. And so you can consider it stomach as really the origin of the body fluids. So if your stomach energetics is impaired, that means that it can really actually show up on the face because of the fact that there's a lot of stomach channel. And so you can say that you are really what you eat. We really reflect uh, on the surface what's happening internally. Thanks for listening.